Welcome back, OSLP family. We are back.
Welcome. We are back
again. And this is our Sleep Life podcast presents
the Dr. Dovec Diaries.
Yes. And this is Kelly.
And this is Mel.
And today's episode, of course, we have Dr. D back in Zoom. Yay.
Hello, my ladies.
Hello. It's so good to see you again.
It's awesome to see you. We have a lot to chat about.
Yes, we do.
Yeah, this is all about pregnancy.
Pregnancy after weight loss surgery, which is a very common question and a very common topic that is not often talked about, like when you research it.
No, and what's funny, I was telling Kelly, I was like, I don't know what to talk about because I don't want to get pregnant. So I'm like,
and I can't get pregnant.
What are all the things?
So
yeah.
literally, we're like, pregnancy is not on our radar, but we got a lot of questions.
Yeah, y'all's want it. So
yeah,
you get what you want.
Yeah.
Yes.
Some of you want it. And for those who don't want it, we're going to give you guys tips too, because there's a lot of considerations about being a woman and having weight loss surgery when you are of childbearing age.
Ah, okay.
No.
Well, do we want to start with that?
We just dive right in.
Yeah, we could just start with that.
Sure. Geez, let's go for it. So I'm going to tell you some history about myself, personal history, because podcasts like this, honestly, I feel like saved me from undoubtedly the darkest of dark moments in my life. As many of you who follow me on my Dr. Dovec, DRDOVEC Instagram know, I am very open about my struggles with infertility myself. I went through infertility treatments for years. I had a diagnostic laparoscopy. I had the horrible dye study where they're looking at your tubes. I had so many tests and ultrasounds and labs, and it was just so frustrating. Like, why couldn't I just get pregnant the normal way? And like people would give you this horrible advice all the time just to relax and it'll happen, and pray on it, think on it, don't think too much, think more. Like, it was just so much. And ultimately I did in vitro fertilization. I went through many egg stimulations. I went through multiple embryo transfers, some of which did not work. And it's truly devastating. And it's a lot. And so I know what it's like for every 28 days to get your hopes up and only to have them shattered and all the emotions that go with it. And so this topic is ultimately my favorite topic because I feel that weight loss surgery is even more effective at helping couples get pregnant, women improve their hormones, their fertility and all that, than even my fertility doctor. Even fertility doctors, reproductive endocrinologists, they're called, REI specialists. Even with them, I feel that weight loss surgeons are actually more effective, have a better track record for getting people pregnant afterwards, getting ladies pregnant. So I can't wait to share my personal experience and my professional expertise on this subject. And as you guys all know, fun ending, I have 3 kids, all IVF. Yes, actually my Adrian was conceived or combined, the egg and the sperm, in 2014, and she was born in 2015. And then Evan and Liv are actually twins. But they were pulled from the same egg retrieval. And they were pulled out in 2015, but Evan was not born until 2017 and Liv was not born until 2018, but they are actually technically twins.
Wow.
How does that work?
I was like, okay, tell me the science behind this.
Yeah.
Yeah. So I mean,
really
they were conceived at the exact same moment, but they were not they were implanted separately. So I don't know. I don't know. Nobody really talks about that, but like technically Evan and Liv are fraternal twins.
That's so cool.
Yeah, that's a cool part of the story.
Yeah.
Like,
it is. One day I'll explain it and they're just going to look at me like, what are you talking about? But
like, we're not the same age, Mom.
Yeah. I know. You're just born a year and a half apart, but you were conceived at the exact same moment.
That is so cool.
That is really cool.
I can't wait for them to know. They're going to be like,
because how old are they now? I can't do math.
So Adrian's my oldest. She is 5. Evan is 4, and Liv is 2.5.
Oh,
Wow.
You got some youngins. I didn't
I
realize how
do.
young your kids were.
Holy moly.
They're young, because that's what happens when you're struggling for years. Should be like 10, 11 years old, but there you go.
Yeah. I mean, I tried for years with Satan, and I know that sounds really bad. That sounds really bad. But we tried for years, and I remember every month it not working, and I'm like, what is going on with me? What is wrong with me? I am a woman. I should be able to do this. And then we found out I don't ovulate. So that kind of
exactly.
Yeah.
Well, that's the thing. That's what we're going to talk a lot about today, ladies. So if you're out there and you feel hopeless and you feel that horrible frustration, and maybe you stumbled upon us, hopefully we will give you hope that this can and will work for you too.
Definitely.
Seriously.
Okay. So the very first one we have is, when do you suggest one gets pregnant? I'll be a year out in August and have baby fever.
All right.
Okay. So there's a fair amount of literature about this. And I actually just looked up the American Society for Metabolic and Bariatric Surgery guidelines before we get on, so I can make sure I have the most up-to-date stuff to tell our OSLP family out there. And
that's why we love you, Dr. D.
Seriously.
The answer to that is when your weight is stabilized. So sometimes it's hard to know, but it's typically a minimum of 1 year. So potentially, if you're at your goal weight, you can go for it.
Okay.
Our practice technically recommends 18 months, and some recommend up to 2 years. So sometime between 1 to 2 years after surgery, you can safely start trying to conceive. The thing with that is sometimes things happen before, things happen after. It's not like a definitive timeline, but there's a lot of research that does show that you should try to get down to as close to your goal weight as you can.
Okay. And then try to get pregnant.
Try to get pregnant.
What's the reasoning behind it?
There has been shown, if you get pregnant earlier, to be sometimes some issues with the pregnancy, even with the growth of the baby and that sort of thing. The main things are about the mother being able to get in enough nutrients with multivitamins and minerals like calcium, iron, those important things, and also electrolytes and fluids. So sometimes in the beginning, you are very nauseated, of course, morning sickness. And if you're vomiting, you could actually have something like a critical thiamine or vitamin B1 deficiency. We've talked about that a little bit on the show before. So it's a lot about, again, making sure your weight is stabilized, because a lot of times if you don't hit it then and then you get pregnant, you know how hard it is now with plateaus and weight regain.
Yeah.
Imagine if you didn't really lose much weight because you were pregnant and nobody really wanted you to lose much weight, or you just didn't get down to your goals. It's super hard. It's not like you have the baby, you just start to go. It's really, really hard. And I think some of the amazing bariatric patient influencers out there have shared their pregnancy struggles very openly. Like Sarah, she has I think it's like the Chick Savvy Bell or something is her Instagram. But anyway, people share that it is really hard to lose weight sometimes after pregnancy.
I mean, I haven't ever been pregnant, but I know for Melanie has. So
yeah, I mean, I would imagine it would be really hard. I just that makes way more sense, because like you definitely have to be able to eat more food to get the baby like nutrition. So like, of course, you're gonna be even more malnutrition than what you kind of are when you first get out of surgery, and those first 6 to 9 months. Like it's hard to
absolutely.
It took me almost 9 months to get the water and the protein all in.
Yeah.
Like I just could never get all of it in,
much less be pregnant and trying to
do
both. All I can think about is the final Twilight movie. Did you ever see those?
No.
So because the final one was 2 parts. So in the first part, she gets pregnant and she can't eat or drink anything. Like everything she's throwing up and she can't handle it.
Okay.
And so she like becomes like this malnutrition, like just skin and bones, and then she's pregnant. That's all I can think about.
Is that ending?
You'll have to watch that, because it's actually pretty, I don't know. I'm obsessed with Twilight. It's fine.
Wow.
But yeah, that's all I
Well,
can think about.
I will tell you guys, I had the worst morning sickness. Like I always thought, Kate Middleton, please, girl, I can show you some sickness. So I wrote a guide to it. So if anybody's watching, DM me on Instagram and I can send you the guide. Just send me your email address and then I'll email it to you. So we talked about that a little bit because I've adapted it to be like a guide to early nausea and vomiting after surgery, but it's actually written from my experience when I was pregnant and I was super, super sick. So that's how I had a lot of similarities between the two. And so I just did the things that made me feel better, and people say it works for them too. So it's a 17-point guide to nausea and vomiting.
I think you might have to send it to us.
I love
so we
it.
can take a
I
look
should.
at it.
Yeah, you guys can make a very cool graphic out of it.
I could.
For
Yeah.
sure.
We could share it with everybody so that they can
Yes.
save it for when it's their time. Yeah, I think that's great.
Yeah, because I hear some women, like, because I feel bad because I was one of the women that didn't puke at all for there, and I feel so bad. I'm like, sorry, you had a bad, but I know there's a lot of women that do. Like they just like, it's very tough.
Let me ask you this though. I have a theory. Now, you had an easy pregnancy, but how was your labor and delivery? Super hard?
I mean, I was in labor for like 19 hours. I don't know
Exactly.
if that's bad or not.
So
but-
no matter what, you're not going to escape without it.
right.
So I was in labor for about like an hour. Like it was nothing, but my pregnancy was brutal, but giving birth was like the biggest endorphin rush ever. It was so amazing. I loved it. It like, I didn't have any pain. I didn't have any issues. It was just like, boop, I just pushed out a 9-pound, 5-ounce baby out. Like it was nothing. It was just a little bit weird. But my pregnancy was brutal. So I feel like you're either going to have one or the other. Like I haven't met anybody yet that was like, it was so easy. Every aspect of it was.
No,
So I don't know.
That was brutal. That was, I remember that. It was pretty bad.
Yeah. My sister's pregnant right now. And and she has horrible morning sickness.
Yeah.
But I think she had an easy pregnancy or easy birth
For her last one.
There you go.
So I'll have to ask her.
Theory keeps going on. So all of you out there, write to us, let us know did you have one that was harder and one that was easy side of it? I feel like you're going to get blessed on one end, but cursed on the other. So that's my theory. I have a lot of thoughts.
Which one you'd prefer? Would you prefer the easier delivery and the morning sickness or vice versa?
Yeah. I think I would prefer an easier pregnancy in a brutal 2 days than a brutal 9 months in a wonderful 2 minutes.
All right.
Yeah.
All right.
I'm like, when you started saying how many times you puke, I do not want to do that. I will do what I did for 19 hours. Yes, I know.
Exactly. 19 hours or like, it felt like time wasn't going to pass. I just wanted to die. And it happened all the time. It didn't matter what the sex was, the girls, the boys, all of it. I'm super nauseous.
Oh, man. And I don't like puking. So I can only imagine.
So much puking, daily puking. I had to puke just to be able to, like the puke and rally kind of phenomenon was extremely real. That's all my very professional tips. I'm like, listen, ladies, get in there and puke up your spit, puke up whatever you have, and then eat immediately.
Oh, is that the rule? Is that what you should do?
That's my rule, and it works.
Yeah.
Oh,
okay.
So that way you can kind of hold down some nutrients. Is that what we're going for?
Yeah, I'm thinking.
Yeah, I mean, like the spit and all this extra saliva. Like I was always spitting and spitting and spitting, and so I would puke it up, get rid of it, and then you can also do things like Flonase or Claritin to try to dry up your secretions so that you're not so like phlegmy and gross.
Oh,
that's a cool idea.
We just send that to Anne.
I should send that to Anne.
Our friend over this weekend, her allergies were so bad. She was just like hacking up a lung. We felt so bad for her. I'm wondering if maybe she should try that.
Yeah,
absolutely. I'm going to send you guys my tips. You guys can use this in many arenas of life. Let me tell you. So,
I'm excited to read it. I'm excited.
Okay, cool.
So then to kind of piggyback on that, we had another one that said, how do you keep from becoming nutrient deficient?
Awesome question. So it's so important. It's important if you're pregnant, if you're not pregnant, if you're a man, if you're a woman, to take your vitamins and minerals as outlined. So that good old ASMBS I was talking to, they have guidelines, and the guidelines have a certain amount of thiamine, folic acid. Folic acid is super important in anyone of childbearing age because it prevents neural tube defects in babies, which is
Wow.
like spinal issues. It can be like spina bifida, that kind of stuff. It's critically important. It's been proved for decades and decades to be essential. You want to make sure your iron is replete so that you're not chewing on ice or having pica, which is where you crave dirt or again, ice. So anyway, what you want to do is you want to make sure that you have a bariatric specific multivitamin. There are some brands that have the true ASMBS seal of approval to them. I love Celebrate brands. It's a little bit pricier, but another fun tip is that you can ask your bariatric surgery program to help you to use your FSA or flex spending, if you have that, to get it paid for, because it's for your health. So what you'll have them do is write you a letter of medical necessity and make sure that wherever you get the which can be a prescription even. I mean, it could just be like, I prescribe you a multivitamin. And then also the receipt, you submit those two things to the FSA and then they'll pay for it. So you can do that for your calcium, for your multivitamin. And then it's important to get your labs checked to see if you have any other specific nutrient deficiencies, particularly looking at that vitamin B1, which is thiamine, vitamin D, the different iron studies like ferritin, transferrin, those sorts of things. PTH, which is an indirect look at your calcium levels, looking at your hemoglobin hematocrit, again, that goes with anemia. It might be megaloblastic, which is B12. It might be microcytic anemias. So basically, get the full set of standard bariatric labs. Any bariatric program absolutely knows what the nutritional labs are so that you can look at those. And then protein. Protein is so essential. It's essential now. You need a minimum of 60 grams per day. Our program actually recommends even more, but a minimum of 60 grams is going to keep you at least out of trouble. And it's going to help massively to do a lot of things for the growth of the baby. It'll actually make you feel less nauseous too. You want things with a very low glycemic index. So you want to avoid like high carb things. It's just not going to give you satisfied. It's going to make you a little bit more nauseous. So really try your best to go for proteins that you can tolerate and multivitamin, calcium citrate. Keeping your nutrients up is absolute paramount to your success.
Wow. That is a lot of information that I wasn't expecting, but I like it. I like it. I was just like, oh, that's a lot. That's a lot going on.
That is a lot.
Yeah.
It's a lot.
I know ProCare has a prenatal bariatric vitamin.
Yeah.
And I believe they are ASMBS.
I think they are too. I think ProCare is as well. I think that they're bariatric specific. They are always at our trade shows and that sort of thing. So I would assume that they're following the guidelines. And I think that they are. So that's another great brand. There's Bariatric Advantage. Really, who cares which one you get? Just make sure that it follows the guidelines. You're taking them as prescribed. I know it's a little bit pricier to go for a bariatric specific vitamin, but you can always, again, just try to get creative with how you get reimbursed for it, because it's important. You don't want to cut corners there, my friends, for your own health and for the health of your baby. Absolutely. You need to follow those guidelines.
Exactly. And most of the time we found that the bariatric specific vitamins are actually not that bad price wise, because you would be buying them all separately if you weren't. And so it actually ends up being like almost double if you were just
So true.
It's a lot cheaper. And then some of these places will just have it delivered to your house, so you don't even have to go.
Oh yeah.
It's really nice.
It's just,
and a lot of these places have like little sample packs, so you can like try different flavors, and they want you to be compliant. So they've gotten very creative beyond just swallowing a tablet, like with their flavor profiles, and they're always coming out with new ones. And you guys always do your unveiling and your tasting of these things, and it's awesome. It's fun.
ProCare's calcium by far, like
the best chews.
They have a dark chocolate calcium one that is like, it's like you're eating a candy bar.
Oh yeah.
Oh yeah.
And I treat it that way.
It's so good. Oh yeah.
At nighttime.
Yeah. This is my treat.
Candy bar.
Oh my God. I'm a recovering calcium citrate chew addict over here. I mean, I love to nibble. Everybody who is my patient knows this. I'm obsessed with the caramel flavor. Like obsessed.
Oh, yes. The salted caramel is so good.
That's hilarious.
It's legit good.
That and the cinnamon roll one. Yeah.
Haven't tried that.
Oh, if you like cinnamon rolls, like this is like spot on to a cinnamon roll. Yeah.
I'm
I'm
like get my
obsessed.
cinnamon roll treat right now. Oh my gosh.
Well, it's
Hey,
really
you got
nice
to
for the end of the evening.
It is, totally is.
Yeah.
With
Little
the
nightcap.
Yeah, it's our calcium nightcap.
oh,
Oh
there
my
you go.
gosh.
Perfect. Who's gonna have their calcium nightcap? We can put that in the stories and be like, who's had theirs?
I
love
love
that.
it. I don't care as long as we are getting people to do it. But remember, if you have a multivitamin with iron, you must take it at least 2 hours apart from the calcium. The
Yes,
calcium and the iron compete for absorption. It's
Mhm.
very, very important you do that. Otherwise, you're wasting your time, you're wasting your money, and it's not effective.
Mhm.
Separate iron and calcium by a minimum of 2 hours. There's my PSA on that.
Well, I have a question about the flex spinning account. So how
Yes.
you're so like they just need to get this prescription and then like the receipt and they send it on in. Now,
Yep.
does that mean even like me and Kelly could do that? Or is that just if you're pregnant?
Yes.
No, you can.
Oh,
Yeah.
yeah.
Make sure
Everyone
everybody's
can do
aware.
that.
We all can do that.
Mhm. Yeah. As long as you have a flex spending account
Yeah.
set up through your insurance,
Mhm.
then yeah, you just need a prescription and a receipt.
Nice.
Yep.
I'm just too lazy and never did it.
It is a lot. They're painful. Like when you use that, they're like, I need proof of all of this. But once you kind of just get it going, you're like, you save yourself a lot of money. So
Mhm.
absolutely
Yeah.
anybody can do that. Men and women, of course, everyone.
That's
Yeah.
awesome.
So little tip for everybody out there, go through a flex spending account.
Yeah, to buy your vitamins.
Mhm.
Like then I wouldn't have to
Definitely.
buy vitamins for my kid, Eric, me.
Yeah. As long as the doctor.
Yeah,
prescribed
all
it.
of it.
Yeah.
Mhm.
That is freaking awesome. Thank you.
Thank
Oh, you're
you.
welcome. Okay. My work here is done today. Now let's
Yeah.
keep going.
Right.
Okay.
So much more.
So we kind of went over the supplements. And then, so we had somebody that said, how much weight gain is normal? How hard is it to lose that gain post-pregnancy? So
Yeah. So there's no simple answer to that because it depends on where you're at beforehand. It depends on at your starting weight and your build and your BMI and all that kind of stuff. So a pregnancy of a person that's at a normal BMI, which we all hate the BMI, it's not the best predictor of anything, but they call normal a BMI of around, like, I think it's 18.5 to 24.9.
okay.
In that range, women will they say to gain on a range of 25 to 40 pounds is the normal range. Now, there are absolutely patients who get pregnant, let's say at a year and a half, they're still losing weight and they come out of the pregnancy less than they started. I'm sure you guys have all heard this, seen this.
Yeah.
Absolutely. I have patients that have lost weight in their pregnancies. Now that bariatric surgery is becoming more common, it's not as like, it's not as shocking anymore, but there is a specialty in OB. It's called MFM, maternal fetal medicine. And that is a high risk pregnancy doctor. And so they used to make all bariatric surgery post-op patients go through an MFM. However, nowadays it's so common that they don't do that anymore. And so we're used to it more. So the weight loss, weight maintenance, small gains are good. Now, I'm going to warn you, do not gain more than 40 pounds. Do not gain more than 40 pounds if you can do anything to help it. A lot of times the problem is people will start to drink like Hawaiian punch, sugary things. It's like, my mom was super sick when she had me. And by the way, it's super hereditary. So if you're like wondering, like, I wonder if I'll get sick, ask your mom if they were sick when they had you.
Oh,
and so, and it's almost like dead on. So my mom said she like lived off of pineapple juice and, try to not do that. It's so hard. I mean, I would sometimes just be like, I just need something. I remember like one time I felt like the shame, like, oh my God, like I put like a hood up, like, because I'm like, what if somebody sees me? Like I went into Little Caesars and I got like a pizza and I sat in my car and I ate it. Like, I'm like, this is against everything that I ever say. And what am I doing? And I even like put it on Facebook and people were like, get a life. Like, of course, everyone has moments, like, you loser. I one time went and got Cold Stone ice cream and I just felt like I literally like tied my hood like you know, like so tight there so no one would know, just so I could get the spoon in my mouth. And I'm like, all right. So I get it. Even like me, who's like, oh, if someone sees me, you have this like magnetic pull to some of this stuff. Try your best to stay to the plan of 3 meals a day, higher in protein, and try not to snack too much in between. you're going to pay for it afterwards with the weight
Yeah.
regain. So just be careful. Be careful.
All right.
Doesn't it seem hard to gain that much weight while you're like after weight loss surgery?
Well, it depends on if you slip back into like nibbles here, bites there, just
Okay.
little amounts, or the worst, if you're drinking things with sugar in it.
Okay.
I mean, you could gain. I've had patients who have gained the triple weight. They've gained over 100 pounds during their pregnancies.
Oh,
And
no.
I know. I mean, it happens. And if you're out there
Yeah.
watching and it's happened, okay. You just gotta like go for it as much as you can and try to get back to it.
So if you gain something, you know, over that 40 pounds and you're having a really hard time after you give birth, trying to lose the weight again, what would you suggest? Would that be a moment that you would talk to your bariatric surgeon? What would be the best route?
So the best thing to do to lose the weight is to breastfeed. It is, I mean, the thing about it is though, I had a really hard time with my milk supply. And that's something that no one else really, I feel like, talks about either. Like, you just feel like, geez, I couldn't get pregnant and now I can't make milk. It was just like, and the whole postpartum hormones and all that, it is a lot to handle. And people talk about it some, but you also think like, oh, that's them. But for me, I'm gonna like, I will not give them that formula. So it's kind of a mind thing. But on my next two, I figured things out a little bit better. But when I did produce the milk, it just sucks the weight out of you. But again, don't put the pressure. If you can't, if the milk supply is not there, then you'll just get back to just get back to the basics. And I think rather than the bariatric surgeon, you go back to the bariatric dietitian or find someone that you think is reputable. Maybe even through Instagram, there's some really talented dietitians out there that truly get it.
Yes. That's a really good idea.
And as far as what I understood, like our milk supply is also based a lot on like getting our liquids in. So
absolutely. You need to drink so much.
Yeah, it's like way more important now when you're pregnant as a bariatric patient to drink your water. Like
a billion times.
Okay.
I mean, when you're pumping, or I exclusively pumped, but when you're getting so much liquid out of you, my mouth was like the Sahara at all moments. It was horrible. I drank 4 or 5 liters a day.
Damn.
Yes. You're supposed to drink at least, this is a liter, you're supposed to drink at least on a normal day 2 of these. Imagine having to pound down 4 or 5 of these. It's a lot of work.
Gosh.
And how do you take care of baby and go pee?
Yeah. How does that work?
You're pumping, you're taking care of this child. It pretty much sucks. So if you're watching this, can I get that did suck. And everyone's like, have you ever felt love like that? I'm like, no, I've never felt exhaustion like this. I've never been in more pain with my nipples and all this stuff. It is not fun.
Oh man. I am kind of really glad that I am never going to have kids. I mean, I love my nieces and nephews, but nope, I'm good.
Yeah.
I'm too old.
You're too old.
Yeah.
I'm too old.
That's like not happening.
Nope. Oh my goodness. Okay. So next question is, does being a bariatric patient affect natural versus C-section birth?
No, it doesn't. That's a great question. I've never been asked that. That's such a good one. Yeah. So obviously C-section versus a normal spontaneous vaginal delivery are the two things there, and it doesn't. So your stomach again is located up under your left rib cage. It's up here, and your uterus is down there. So even when the baby comes and everything's pushed up and all that sort of thing, it doesn't matter that your stomach's smaller or that even that you had a bypass and your intestines are rerouted down below or a duodenal switch or something like that. It doesn't matter. It doesn't impact that at all. The thing that impacts it is more your frame and your build and your hips, that childbearing hips type of a thing.
Yep.
I mean, I have a very wide pelvis. I mean, like I was born to deliver babies.
Yeah.
I really, I mean, I'm super tall, all that sort of thing. Some things that you can do is to really strengthen your quads. It just makes like pushing the baby out a lot easier. But again, there's nothing you can do about your bone structure and just your pelvic outlet and all that sort of stuff.
Okay.
All right. Well, that's good.
Yeah.
I had a feeling something that was going to come up because even I would be like, wait, does it mess with it? Did I have to cut differently? Like,
No,
yeah.
nope. Totally different turfs. Totally unrelated.
I always
Awesome.
forget that the stomach, like you would think after this long of doing this podcast and like everything that I would remember that the stomach is up here. No, I don't.
Yeah. I mean, we watched it.
I know. We literally
I was just
watched
gonna
it.
do a I was just going to plug that. Now, everybody out there, if you haven't seen it already, Kellie and Mel were in with me in the OR and we were filming a sleeve operation. Now, the thing that they loved, and if you watch it, you'll see, is remember the proximity of the heart to where I was working. So just think, it's all the heart you could see beating through the diaphragm muscle. You could see the sheen of that almost, you could see it coming kind of at you. And just think that that's exactly where like the spleen was and the upper portion of the stomach was. So that's where all this is. And everything else is like down south. We're up north.
Okay. I just think it's funny because you're always like, my stomach, and you point to your, like, to your belly, but it's not really there.
Well, that's like a pet peeve of a lot of surgeons, because it's your, we should say like, my abdomen is hurting. Like, you know, but like when my daughter's like, my stomach hurts, I'm like, yeah, I'm not going to correct you to be like, no, it's your abdomen. What quadrant? Is it the right lower quadrant, the right upper? Where is it hurting specifically? The stomach, isn't it?
I feel like she should just know.
Just sound like a psycho.
Oh my
she
God,
should know. I kind of corrected her before, but I was like, okay, she's gonna look like a freak if she's like, my abdomen hurts. When she says my stomach hurts, I'm like, go take a poop.
Take a poop.
Half the time that
like,
is.
do you need a poop? Yeah, I need a poop. All right, well, it's not your stomach, it's actually your colon, and probably more like your rectum. It's probably your rectal vault. That's what's happening, and that's why you're cramping right now. It's not your stomach. That was like hours ago when it was up there.
Yeah, what is a vault? Yeah, what is that? I've never heard that term before.
All right, ladies, let me fill you in on a few things, okay? Yeah. So I'm going to go through the whole GI tract very quickly. You put food in your mouth, and then it goes into the tube in your chest called the esophagus. The esophagus then goes through the diaphragm and goes into the stomach. Now, it's called gastroesophageal reflux disease because sometimes the stuff that's supposed to be in the stomach refluxes back up into the esophagus. It's a hiatal hernia if the stomach, which should be in the abdomen, has herniated or goes above the diaphragm and is now in the chest. So there's varying degrees of that. After food leaves the stomach, it goes through the last part of the stomach, through the pylorus, and then it goes into the first part of the small intestine, which is called the duodenum. The second part of the small intestine is the jejunum. And the third part of the small intestine is the ileum. And then it finally goes into the right colon. That's also known as the cecum. The cecum is where your appendix is. It goes up the right colon, across the transverse colon, down the left colon, into the sigmoid colon, which is curvy like an S. Then it goes into the rectum, which has a rectal vault, which is where, like, when you really have to poop, sometimes poop is sitting in the rectal vault. So like you can squeeze your muscles to keep it in the vault before you let it relax it, and it comes out, and then it comes out the anus. And there you go.
Wow. I had no idea about most of that. Yeah. I mean, apparently we need to go back to school or academy.
No. You know what's crazy? Like, I can't tell you, like, people are like, oh, my arm hurts. I'm like, I don't know anything. I don't even remember the major bone names. It's crazy. But like the GI tract to me, I don't know. Like, I remember it was like nutrition 101 in college in 1999. And I'm like, oh my God, I love the GI tract. I'm obsessed with the GI tract.
It's super interesting.
Yeah.
Especially like the fact that it comes up and then back around and then down. So
and then
like,
it has its own little vault that it sits in.
So like, I mean, I guess like as it's going through, that's why like different parts of your like abdomen area might hurt because your poop's kind of like going through. Is that what I'm understanding?
Exactly. Like sometimes when it wants to come out, it doesn't like to be stopped. And so it's like cramping and kind of like peristalsing. So like the peristalsis is what takes it from the mouth to the anus, is constantly propelling or peristalsing it forward. So when you hear your stomach growling, it's just things moving. And sometimes you're like, I'm really not hungry, but it's making sounds. And sometimes the sounds, I never can pronounce it right, but the technical name for that is like origami. Origami. I'm sure some surgeons watching me right now rolling their eyes because I'm saying it wrong. But so that's the technical thing.
That is so
technical
cool.
term for it.
Interesting.
Yeah. No
Yeah,
idea.
yeah. Now I know why my stomach like growls and talks to me, because the food is moving at a faster rate.
Is a different rate, and at first things are like out of whack. So it like normally like your body's so used to propelling it one direction, especially if you have a gastric bypass. It's weird because it's like, wait, it's going here before it went this way. It went east, but this time it's going south. And so it's like taking different turns and that sort of thing. I just want to tell you, I just want to tell our fans something super, you're not going to even believe the twist that I'm going to take you guys on right now.
Okay.
But I have to go there.
What is it?
I have to go there. This is something that is never talked about, but I'm going to talk about it publicly. This is an OSLP exclusive here.
Oh, okay.
All right. So some people, since we're on pregnancy, of course, that means sex and that sort of thing.
Yeah.
So some people have some interesting fetishes and that sort of thing. And some people like to put things into their anus for stimulation.
Yes.
So here's the thing. As a surgeon, I have seen many, many things, and every surgeon out there, I will bet anything, also has these stories where people will put things that are not supposed to be there, and unfortunately they put it into their anus. Like I've seen like a Sam's Club like dispenser, and then what happens is, remember that rectal vault, like it's meant to like suck things in and hold them. So if you go beyond where you're supposed to go, sometimes it'll go up and get stuck. So I've pulled out Gatorade bottles, dispensers, all kinds of different things.
That just made my butt pucker.
Listen, everyone out there. So if you're into that, be very careful that you always keep a grasp on it, or just don't do it. So it's something, listen, I get it. I do not judge anybody for anything. That is why I hope I'm a very cool doctor. It's like, you do you. Yes. But I will tell you, I have seen people end up with stomas because they perforated their colon, and then they have to go through a huge ordeal because of this. And it's like, oh, I just feel so bad. It's just it's so tough. I don't do that surgery now, but when I'm a general surgeon by trade. And so when I was in those 5 years of residency, I saw a lot. So when you're fascinated by the rectal vault, I've seen that thing. I'm like, oh, suck up something.
Well, I remember I always thought that. I was like, if you put something in your butt, you're just going to suck it on in, right? Like that's just going to.
Well, like, yeah, because that's yeah. Oh, wow.
So
what's funny about that is we were like literally just talking about that over the weekend, because we had a girls' weekend, obviously. So we're talking about all things sex, because that's what we do as girls.
That's right.
And we were playing this game that was never have I ever.
Yeah.
And it was like this card game.
Yeah.
It's a fun game.
It was a card game, and it's perfect for a girls' weekend because you learn lots about each other.
Yeah.
But anyway, so we were talking about that. So it's kind of funny that you brought that up.
Well, because that's just going to keep going with it.
Yeah.
So
go ahead.
That's why they have those stoppers or something on those things.
Exactly.
Yeah. So just be careful, people.
Yes. Don't put inanimate in, what's the word?
Inanimate objects.
That. Yeah. Don't put like random things up there. Like just
random
like
things.
Steve-O when he put a little car up his butt and stuff.
Yeah. Like go to the sex store and get what you need to do that
safely.
Way. Yes. Safely. Yes.
Safely.
Yes.
Safely. So I just had to put that out there because no one ever really talks about it. I mean, I've used some like towel clamps to yank some stuff out of there.
That's just like, oh my God.
I envisioned you like with clamps.
It's like the jaws of life to get in there and then get it out.
Oh my God. Oh my gosh. If you guys are not watching this video, you like seriously, you need to.
Oh my
because
God.
That was
like
that was priceless.
My butt's like, no, don't do it.
But listen, some people out there, that's their thing, like I said. So
and there's
anyway,
no
I just had we were talking about the
Gatorade
rectal vault. You guys were intrigued by it. So yeah, big Gatorade bottle. So I know you guys are I just had to make sure that everyone out there with the rectal vault thing understands it.
Yes.
Seriously.
No, I think that's good, because we did have our sex episode, which is one of our top downloaded episodes.
That's right.
And because people want to know about sex, especially post weight loss surgery.
We might have to do it just a sex episode with Dr. Patterson, not Dr. Patterson, Dr. Dovec.
Who we talking to?
I could, yeah, we could talk all kinds of things with it, but yeah, well, we have a lot of episodes that we need to get through, don't we?
They keep growing, and that's a good thing.
That's right.
means we'll never run out of content for you.
Never.
Back to the
Never.
questions. No more
Thanks for tuning in, my friends.
Exactly. Okay. So people say bariatric babies are smaller in size. Is that true?
No, that is not true.
No, that's what she wrote.
Is that just a myth that's going around?
I
validity to that.
I have never, I will look it up. I have never read anything or thought anything of the sort. No, I don't think that's
Okay.
true. I've never seen that or heard that.
Okay. I wonder if it's just people being,
Well, they're like,
assuming. I'm
assuming.
wondering if they're assuming that it's because you cannot get in as much nutrients, so how can your baby grow as much? But
yeah,
listen, here's the deal with the body, the way it works. If you're not taking in as much, it's gonna replete you, and then it's gonna go to the baby. Like you will become an afterthought to it. So it's basically eating and all that is to keep yourself replenished, even more than that, because it's gonna get it out of you.
We're the host, so it's feeding off of us.
That's
the
true.
whole time.
Absolutely.
So it's getting all the reserves.
Yeah. You
So-
are.
Yeah.
You guys are the hosts.
We're the
The baby eats first.
Is it true that pill form birth control doesn't work after surgery?
Okay.
That's a great question.
So it's a great question. So oral contraceptive, there's estrogen containing, there's progesterone only types. The question comes down to the efficacy of it in terms of the absorption of these types of methods. And the truth is that now we don't, for example, with the gastric bypass, we're not bypassing as much. And so I believe that birth control is still effective, although there are studies that have shown that it is not, because it can be malabsorbed. So the consensus is, if you were to recommend a birth control with the best efficacy, which absolutely has no bearing on if you have bariatric surgery or not, would be like an implantable or an IUD.
Okay.
Yeah.
Intrauterine device that's placed and removed typically every 5 years.
Okay. So that's what you would recommend over just a pill form birth control.
Yeah, and I would not. And the other one is the injectable progesterone, like Depo-Provera, which I've said before. I would not go there because those you gain weight, and it's just like, ugh, I just think it's gnarly.
Yeah.
But I still tell my patients the pills are fine to take.
Okay.
So I'm going to say it is not true anymore that oral birth control does not work. It still works. The thing about the IUD, if you still want to have a baby, sometimes there's some with putting that in, it could impact your fertility negatively a little bit down the road. So it's something to consider. You could get scarring there. It can make it harder for the cervical os to be open to permit the sperm from going in and that sort of thing after its removal.
Okay.
Some people have no problem. I mean, 1 in 100, or maybe it's like 1 in 200 will actually get pregnant even with an IUD. So.
Oh, wow. Well, and for everyone that's listening, I've had the Implanon.
Yeah. And I did too.
And I had it for like 9 years and it works. Like that was not a problem.
I gained weight with it. Like
you did.
Crazy amount of weight, like 25 pounds in like 2 months.
Ooh.
It was insane how much weight I gained. And so I went back in and I was like, take it out. I don't want it in. Like, I can't do this, because if I keep gaining like that, nope.
So when it came out, did you feel like you started to lose weight again?
No, it all like just stayed on. It was like,
I know, like, I don't know, is that really the Implanon though? Or is that just like, I don't know, just like us having bad habits and just gaining weight? And
I don't know.
all of the other medicines.
I mean, I feel like that's a lot of weight to gain in a very, very short amount of time. Like, even if you're eating 5,000 calories a day, like that's still a lot of weight to gain. So, and that
I
was
agree.
Right around the time that I decided to have weight loss surgery. So it was like, I took out the Implanon and then it was like almost surgery time. Like,
I see. Yeah.
Because my other one had ran out. And so they had to replace it with something. And then I was like, just do the same thing. And then, then the weight gain.
You know, I'm a firm believer. If you, in like watching and listening to people, like if you said, I legit was doing fine, and then I gained 25 pounds in 2 months, and it was absolutely directly related to when I had this placed. I mean, I'm going to believe that. Like, okay.
You know your body the best.
yeah. And it's like, I'm not eating anything differently. Like, I'm not like, I don't know what's going on here. I think, well, all right, that makes sense.
Yeah. Yeah. I feel validated. So thank you.
I just know you really well, and you're on a lot of medicines, and so a lot of those can make you gain weight too.
Yeah.
So I just didn't know if it's a combination. And the only
Could be.
reason why with those, because like I was always like, I was bigger when I got it, and I didn't get any bigger because I was on it. So that's the only reason. It's like I didn't have a bunch of weight gain.
Yeah, my meds didn't change within that time. So I was still taking this exact same meds, the exact same things. The only thing that changed was the Implanon. Yeah.
And there you go.
So yeah.
That's what it was for you.
I don't know what it was, but it didn't like me that second
But
time.
it does work.
It does work.
We do know we didn't get pregnant for 9 years. How long were you on it?
Well, I don't ovulate, so there was no need for me to be on it in the first place.
Damn, yeah. Why were you on
But listen, that is a perfect little setup. I just want to tell you guys that when you're like, oh, I don't ovulate, the minute you have weight loss surgery, things start to happen. I have heard that many times. People are like, oh, I can get pregnant. I'm just, having unprotected sex. I'm not worried about it. And like invariably, it's like people get pregnant. I'm telling you.
Oh no.
I don't have a period at all.
You'd be surprised though.
Yeah,
really?
You very well may.
Yeah.
Yes.
Okay.
You might be ovulating, girl. Be careful. I'm not even kidding.
Well, I'm not having anything. So right now, like, yeah, sexually related. So
no sexy time
for me. So I'm safe right now, but I know when I start, I'll be like, okay, what did you say, Dr. D? What do I need to do?
You just come to me. I can do a private consult over Instagram DMs on this subject. We can just really go for it.
Thank you.
Cool.
Appreciate it. Okay. So then somebody said, I'm scared of getting surgery, then gaining all the weight back when becoming pregnant. Is this valid?
No, I mean, listen, if you stay pretty much to your typical routine and the guidelines, I have seen many patients that have this most adorable post weight loss surgery baby bump. You guys have all seen it. They push the baby out, and I swear they leave the hospital like, are you kidding me? So there's some people that, again, you just don't gain much weight, or you just gain it all in the baby and the other, the blood volume increase and all that sort of stuff, and you're fine. So just because you get pregnant, you don't have to look at it as like the kiss of death, like your surgery is never going to work again, you're never going to lose the weight. No. I have so many patients that are right back to their goal right afterwards, or soon thereafterwards, or you can achieve it. Don't worry about that.
Just worry about keeping yourself healthy and your baby healthy.
Yes.
Yeah.
That's it.
That should be good.
And if you're so another question that we got was, should they get pregnant? So if you are good, like you can have babies, you're having no problems, should you have all your babies before you have surgery?
Or that's a good question. Actually, it's a tough one, because the thing is, there's undoubtedly an immense amount of research and proven facts that your pregnancy is going to be safer than after surgery than it is before surgery. Period.
Oh, wow.
It's safer if you're not obese and you're carrying a child.
Yeah.
It's safer on you. You're going to have at least a lower chance of having preeclampsia, which is high blood pressure in pregnancy, which can go and be even scarier with eclampsia, seizures, that sort of thing. You're going to have a lower chance of having gestational diabetes. You're going to have more of a chance that you're going to go all the way to full term. You're not going to have a premature baby that might require a NICU, which is frightening. And the baby develops just much better. Now, if you are obese, and so therefore, like before surgery and you get pregnant, there is an increased risk that you would have macrosomia, which means a big baby. And that's typically linked to the gestational diabetes. And believe it or not, some babies have to go to the NICU, into the intensive care unit for neonates, because they're so big and they're so used to like a certain level of sugar, and their blood sugars are all off. They get hypoglycemia afterwards from the withdrawal of the sugar. It's just like having like a drug, and you're withdrawing these babies after they're humongous babies that have to go to the NICU.
I had no idea.
No.
oh my God, my mind is blown. Like I had
Oh
no
my
idea
gosh.
that that was a thing.
So,
But
Oh,
it makes
yeah.
sense when you think about it. Like you're
Yeah.
eating all this sugar, all these carbs, like you're feeding the baby whatever it wants or what you want, you know, however you want to look at it. And then you're taking like you're giving birth to the baby and it's like cold turkey. Like you're just like, nope,
you just
no
cut
more.
them off.
Yeah. Huh.
So it's almost like a sugar addict baby.
Yes.
Okay.
Holy crap. So that's why
Yes,
it's so
actually,
important not to
yeah.
have stational diabetes.
Uh-huh.
Ooh.
Gestational diabetes is you don't want to have that. You don't want to have that for so many reasons. So I mean, sometimes you can't help it, obviously, but a lot
Right.
of it obviously is tied to your diet. So just
Mhm.
my friends, I know that you'd much rather the sugary option, but just keep telling yourself, like, I mean, my first pregnancy, I went to Panera and I actually got a cookie and I had it in my bag. And the OB, and this was with Adrian, my first one, she was like, she's like, why are you going to eat that? I'm like, because I want it. She's like, but why would you do that? Like, and it wasn't even beating me up. She said it in a place. After that, I never did that again. Like, it was just sort of like a wake up, like, I really need this cookie that bad. Like, why would I do that? Why would I risk stuff? I don't know. I just felt like it was like,
Yeah.
it was the way she said it and all of that. And I'm not trying to be like, oh, never have any sweets or never have any fun in your life and that you're not human and we don't all make mistakes and I didn't just, eat cake on my birthday. Like, of course, like those sorts of things. I mean, life is life and you're going to live it. And I want you to live it and enjoy it and all that. But just remember, slip, don't slide. I know that Jana said that that's her favorite mantra, but it's so true.
It is.
Yeah.
It's so true. It's a slippery slope, guys. And you just, you want to like plan for what you're doing and then get right back on track. Just a slip,
Amen.
not a slide.
Yeah. Like
You
for
got
your
it.
birthday
Couldn't see that.
weekend.
Slip, not slide.
Yeah. We
There we go.
planned
Yeah.
that we were going to have mimosas.
We were gonna
and we were gonna
drink.
drink some wine and do shots, and we knew it. And then today, what did we have? We had egg bites, we're having water, like we're taking our vitamins. Like, you just have to get back in it.
Yep. Because I knew that I wanted to enjoy my girls' weekend, my birthday weekend. I wanted to enjoy it. Did I have mini bundt cakes that
So good.
this and the other best friend got for me? Like, they were so good. It was so good. I've never had a bundt cake before. And
these are just
bundt
mini
cakes.
and they're delicious.
Yeah, they're just like little guys.
Yeah.
I have a picture.
Oh my
I'll send it to you.
Send me
They're
the
adorable.
picture.
Yes.
So did you have a fun weekend though?
Oh, it was the best. It was just what I needed.
Yeah.
Like,
oh, good.
I needed to get out of my house. I needed to like have that mental break. And it was like, so none of us, I know we're totally side storying, but we drove up there and all of us thought like this was going to be like this sunny, like desert climate. Don't know why we thought, because we're going up a mountain.
Yep.
And we get there and there's snow.
Ooh.
And I'm wearing flip-flops. And like none of us thought like, hey, why don't you bring some warm jackets and sweaters?
No jackets, no boots.
No.
I mean, it's May and it's been sunny in the valley, but we just forgot that like Mount Hood is going to be cold.
Yeah.
Yeah.
So we get up there and we're just like, oh, this makes sense, but none of us thought of that. So, and there was 5 of us. Yeah. There was 5 of us there. Like none of us. Oh my
God.
So, but it was
fun.
it was funny because it was my first experience of like getting drunk after bariatric surgery.
Yeah. It's our first time.
And like, that was kind of an odd feeling because it just goes so quickly.
So fast on, so fast off.
Yeah. Like we were at dinner. I took a shot. I was drunk, like numb lips.
Oh yeah.
Like the whole room went boom. And I was like, oh,
okay,
that I'm drunk. Like I remember this feeling. And then by the time we drove back to the rental house, which was like walking distance, I was like,
almost
good.
Sober.
Yeah.
Oh, you were like buzzing?
I was like just under buzzed.
Okay.
And like Melanie's like, okay, let's take another shot. And I was like, sure, why not? Like, I'm not really feeling it anymore. Like it was so quick. It was weird. It was weird, but I don't know. Like it was just an odd experience.
Yeah, you sober up really fast.
Yeah.
Yeah, it's a fast on, fast off.
Which is kind of a good thing, but then kind of a bad thing. I don't know.
Yeah, that's a big transfer of addictions. That's a whole nother talk. We got to talk about that.
Yeah.
It can be a real issue for a lot of people, like scary stuff.
Okay.
And I don't think that's talked about as much as it should be either.
No,
it's not. Nope. It's really not. I've actually been interested in the transfer addiction
and learning more about it. Yeah. We'll have to do a whole thing about it because it can go so many ways.
Yeah. So many different directions. So, okay, on to the next.
On to the next.
Now that we just went
Pregnancy question.
completely sideways.
Okay.
So what happens to your stomach and skin during pregnancy after having weight loss surgery and a tummy tuck?
Okay, so if you have weight loss surgery and a tummy tuck, oh boy, that's going to be it. I mean, here's the deal. It stretch marks and that sort of thing completely across the board, all over the place. Thank God I didn't have any stretch marks. Some people get so many stretch marks. It just has to do with like so what a stretch mark is, there's the outer portion of the epidermis of the skin, and then the next layer, the dermis, is stretching faster than the epidermis can handle. So that's why the stretch marks appear. So and so some of them can be very, very deep in color, you know, and all that sort of stuff. So let me tell you guys again about the order of doing things. I would not have a tummy tuck until you are absolutely certain that you are done having kids, if you can, but sometimes life happens. That's the word of the motto here. And if it happens, I mean, what can you do? Like, again, I can't answer that question. For example, I'll tell you one that comes to my mind. She didn't have weight loss surgery, but Ice-T's girl, Coco, she obviously had a tummy tuck. And when she was pregnant with Chanel, she like didn't look like she had anything because it just didn't expand much. It was like the freakiest, craziest thing. So you never know. You might I don't know. I can't predict that answer what it's going to look like.
Okay.
But after surgery, I mean, the thing is, if you were to ask me this, which one do you think that you're going to get more loose skin from? Pregnancy, or forget about the tummy tuck, pregnancy or weight loss surgery? I would say you're going to get more loose skin from pregnancy.
Oh, interesting.
I was going to say weight loss surgery. Oh,
absolutely. Pregnancy. In my anecdotal experience, I've operated on 4,000 people. I will tell you, it's the pregnancy that gives you more of the loose skin through here than even losing a lot of weight, because it's all focused here. You got this bowling ball right here.
Yeah.
And so I feel like if you're going to get loose skin, you're going to have a little bit of an idea from it from your pregnancy.
Okay. So you would recommend weight loss surgery, then do all your pregnancies, then do a tummy tuck.
Exactly.
Awesome.
That's the order I would do.
All right, cool. And of course things happen, but you know, if you can stick to that order, great.
Or have your babies well before and don't have babies after.
Yes.
Yes. And what I see a lot of tummy tucks and then bariatric surgery. Like I see it at least, I'd say 25% of the time. Oh yeah.
Really?
Very common. Very, very common.
Wow.
A lot of people get their tummy tucks and then they gain some weight. But what I have seen though is when you start to lose the weight, you're not going to have like loose skin again there. It's going to go nice in again.
Okay.
So it's actually not a terrible thing, but if you want the best cosmetic result, you don't get your tummy tuck before bariatric surgery, but sometimes you don't know that you're going to gain some weight and then that sort of thing.
Okay.
I see it all the time. I also see, I'd say 50% of the time, belly button rings.
Wait. I don't know if I understand.
Belly button rings, you know, like, you know, like.
So you see them more
in 50% of the time that she does.
50% of the time, I just see like so many people have belly button rings. It's always like fascinating to me. At some point in their life, they had. Yeah. Random little fact.
I was thinking, are they stuck in there and you're just.
No. I could just see the track where it was.
Oh my gosh. Oh, okay.
She's like, now I'm on the same page.
Well, I was picturing you like, because of that one incision you do, like how you go right next to the belly button. So I'm like, are you finding belly button?
No. I'm not finding anything in the belly button. That's rectal vault. That's other stuff.
That's rectal vault.
That's a rectal vault. That's where we find the treasures. In the belly button, I don't find anything but maybe some lint and some old debris. Other than that, not much.
You got old debris in your belly button. Yeah, you should probably figure that out. You
would be shocked, my friends. That's another little fun fact. please clean your belly buttons. But, yeah.
Before you go into surgery, clean your belly button, people.
Just on a regular basis, clean your belly button.
Yeah, I mean,
No, you'd
really,
be
you
very
should be.
surprised.
Oh.
Everyone's going to be paranoid about that tonight.
Remember when there's an episode about me saying you need to
smell your belly
button.
Yes.
Right. Okay.
Yeah, she's weird. She's weird. I still have not smelled my belly button.
I'm not that flexible.
Well, no, with your fingers.
Oh, like you want me to bend over and smell it? Oh.
So the story is that like I was in the shower and I was washing my tummy and my finger went in and I was like, this smells really funky.
Oh my God.
I was like, oh, this smells like big. And then I'm from a family of all big people and I was like, this smells like a fat person. And I was like, oh no,
what a story this is.
I was like, oh no, I smell like I'm a fat person. And I was actually big and not just like realizing it, but like that's how all that came about.
Yeah.
Wow. Yeah. What a breaking point.
Yes. Yes. I was like, she's like, you've never smelled your belly button? I'm like, no. Yeah. I don't feel like I need to
know.
Yeah, I don't care what my belly button smells like.
I think you should, and then you'll know if it needs to be cleaned or not.
I clean it every day. So I think I'm solid on that point.
I mean, I thought I did.
Good.
Wasn't clean.
Back to the questions, people. Okay.
Ooh, okay.
Sorry, Dr. Dovec. I'm very random.
You're random, but that gave me something to think about. Interesting.
Oh. You'll have to.
I'm curious.
Yeah. IUGR seems really common for babies of bariatric mamas. Tips on how to avoid it.
What is that?
So IUGR is intrauterine growth retardation.
Oh.
Which basically means that your baby is not growing as it should. And that's why they check your fundus height, they check ultrasounds, they check on the ultrasound, it'll tell you how far along the baby should be based on the size, these dimensions of the bones and the abdominal and all these different measurements. And sometimes if the baby's just really not progressing, they might even induce labor earlier and that sort of thing to try to help to control that outside of the uterus. Again, that kind of goes back to the question of are the babies smaller afterwards? I don't think that there is a consistent proven thing by any means that shows that having bariatric surgery gives you more IUGR or more or just more smaller babies. I don't think so.
Okay. All right. And I mean, as always, just stay up on your protein, stay up on give yourself and the baby as much nutrients as possible.
Exactly. And stay up on your prenatal appointments with your OB and all of your ultrasounds and just have regular checks. I mean, it's just super important.
Okay.
So I don't know if this is a dumb question.
Nothing is dumb.
But
nothing.
Can you prevent IUGR?
No.
It's just
is it
random.
Just genetic or is it random?
I mean, it's just like any condition. Again, if you're like completely starving yourself, then maybe. But again, if you're getting in anything and your body already has some stores, the baby will suck it out just to continue to grow at the right pace.
Okay. All right.
Interesting.
I want to start trying to have a baby at a year post-op. What are the risks if you don't wait?
So the risks if you don't wait go back to all the things we talked about in terms of more risk of nutrition deficiencies, more risk of not losing the weight you need to, and then, not hitting goals, having a harder time losing it afterwards. I did see one thing that sometimes the baby may be a little bit more premature because remember, it all goes back to the risk of being obese and carrying a child. So there's all of those things, premature birth, maybe a higher risk of preeclampsia or the high blood pressure thing, the gestational diabetes. So until you kind of get the obesity off the table, normal weight, healthy, getting in everything, know what you're doing, those are the risks.
Okay. Cool. I like that. All right. A lot of them are this kind of the same.
Are we running out?
Yeah.
Oh,
one person said, because I said, Dr. D wants to know your questions. She goes, all of them. Seriously. So many. And I was like, okay, well, that doesn't cover. So shout out to Rachel, bypassed again. for that. Because
Yes, I love the
that was the best one.
enthusiasm.
All of them.
All of them.
And I was like, okay, all right. And then how long after you give birth should you have surgery? Bariatric surgery.
Ooh, that's a great question.
Mhm.
Oh God. I don't know what the consensus is on this one. I don't know what the literature says. I tell
Mhm.
people, like, when they're like 3 months postpartum, if you're like resting and things are stabilized, the baby's sleeping a little bit better, you feel you're healed up. Like if you had a C-section, no, we got to wait a little bit. But it was a normal vaginal birth and you're doing okay and all that kind of stuff, then we can go for it like
Okay.
sooner rather than later.
So
I
if
don't know. I
you-
don't know the exact answer on that. I
Okay.
just take it on a case by case basis. And some people are
Okay.
like, it's their third or fourth kid, and they're like definitely done having kids, and
Mhm.
they are like a seasoned pro at this motherhood thing. If it's their first kid C-section, I'm gonna be like, we got to just chill out.
Yeah. How long would you say for a C-section?
I'd say like 6 months. I mean, you got to
Okay.
really be healed. That's
Okay.
a major abdominal operation. I mean, you're cutting the rectus muscle, you're pulling this baby out, you're sewing the uterus.
Mhm.
It's an open surgery on your abdomen. So you need to heal from that before I go back in and, do a laparoscopic surgery. No way. Yeah.
Fix it all up again.
I just
Yeah.
thinking in my head, like, because at 6 months, would you even want to have another surgery right around that time after having a baby? Like, it's not even like, I don't know who asked the question, but just know you're probably not going to feel like it.
Yeah.
Like,
It was actually sarahsmile.psg.
well, Sarah, you're going to be tired.
Mhm.
You're going to be exhausted.
Yep.
The last thing you want to do is deal with like another surgery and how do you need to eat and drink and on top of a brand new baby. Just
Yeah.
FYI.
And then there's the consideration of breastfeeding and all that
Yeah.
into it. And listen, it'll come. Like, wait till
Right?
the baby's a year. Like, I know.
In my
Everybody just
head,
wants it so bad, but it's like, I know you gained weight during the pregnancy. I have had patients who literally, I feel like they push the baby out and then they like come back like, can I go now? Like, seriously, like, I'm ready now. Like,
Mhm.
all right, we'll see.
You're like, hold on, hold your
Hold
horses here.
on.
Yes.
Yeah, seriously.
Yes.
Well, because in my brain, it's like, okay, how about we have the baby and then we breastfeed for a year? I know everybody has their own views about breastfeeding. I enjoyed it. I just only did it for 3 months because I had to go back to work. But
Mhm.
Yeah.
I would have done it for a year if I could, because you are going to lose weight while you
Yeah, and you
breastfeed.
did.
And I lost weight. So
Mhm.
it's like, you guys can do that for a year and just see where your body kind of lays, because your hormones are all the way through the roof.
Mhm.
And then is it true that our organs like take a while to like adjust back once the baby's out? Like, or is it like a snapback or?
The only thing that's adjusting is your uterus size, and that
Okay.
shrinks down quickly. You remember those like gnarly contractions that, especially when you're breastfeeding at first, and has the uterus just contracts down. That's why they're always like feeling you to make sure that it's contracting as it should.
Okay.
But that only takes a few weeks.
A few weeks.
But that should be back to the size pretty soon. So I wouldn't like operate on someone like one day postpartum. That uterus is still in my face and everything like that if I were trying to get in there. But otherwise, the other organs don't get messed up or moved or anything like that. It's the uterus is the only thing that's like growing and then shrinking down, contracting down.
Oh, that's a myth that I heard then, because I was
Yeah.
always told that like, oh, it takes like a full year for your body to be back to normal
Like inside.
No.
A bunch of BS. Bunch of
No,
BSers.
not to me. I don't know. I think it looks all good in there.
What
Pretty soon
about
thereafter.
your hormones? Like, how long does that take to kind of get back?
Level
Oh,
out.
Oh my goodness. The hormones can be vicious. I mean, there's this whole thing of postpartum depression, postpartum psychosis. There's a lot of euphoric ones, a lot of horrible ones. There's the ones that help you to start breastfeeding and all that stuff. So that's an impossible one to give you an exact timeline.
Right,
I think it takes a while though. It takes a
Yeah.
while. That's
Like,
what they're
like
saying.
a
Like some
year
people
or more, right?
sometimes more than that. I mean, sometimes
Yeah.
like kids are, I think that they're diagnosing postpartum up until the kid's like 2 or something.
Wow.
I might be
That's a
wrong. I might
long
be wrong on
time.
that. I might be wrong on that. I don't know, but it's longer than just like a few weeks. That's for sure.
Yeah, definitely.
Wow.
Definitely. So all
Um,
your dads out there, bear with us.
Yeah.
Just bear with it. You have no idea.
back.
It is so hard to be a woman. I always tell like these women who come in like you, like I had I had the Implanon, and then I gained weight, and then I was on birth control, and then I had to get an injection, and then I had a baby, and then my boobs are big, and then they're saggy, and then they're men, you have no idea. None.
No
I mean,
idea what
it
we go
is,
through.
it's a lot. I always tell women that. I'm like, oh, and then they're like, after I had my hysterectomy, I feel like I really gained weight. And I believe them. I see repetitive trends. And you think,
Okay.
I don't think people are just like, again, like making excuse. I think, no, that they're legit having a major issue with their hormones and things after you mess with those organs.
Yeah.
Yeah, that makes sense.
I think that, yeah, I'm right there. I know that I just had a thought and then it flew out of my head. It happens every single episode. I can't like I have it and then I get focused in on what we're talking about, and then it like slips out of my head.
I feel you on those.
Is postpartum genetic?
I think there is absolutely some degree to that, and to other mental health struggles, other depression with or without postpartum. I don't know the degree of it. I don't know. Like, I know the morning sickness, there's a huge correlation that you're pretty much gonna get it.
Yeah.
If your mom did.
If your mom did. The postpartum depression, I don't know the exact rates of how it's how it's inherited and that sort of thing.
Okay.
I would say yes. I would say yeah. I mean, mental health and all that is definitely like, it's very hereditary, I think, in a lot of regards.
Yeah.
And this might be a taboo question about postpartum, but like, is there an age like range where like it's worse than for others?
I don't think so. No.
Okay.
I don't think it. I think it's just so variable. I was in my late 30s when I had my kids, and I definitely had postpartum with the first one with Adrian. I just couldn't stop crying, could not stop crying, like just could not control myself, couldn't. But then the next two, I felt I was okay on those ones. It's very weird. So, and I was older, so I don't know.
Okay.
Interesting.
And because we're talking about mental health postpartum, what are some warning signs that we can look for our loved ones that are going through it, just to make sure that they're okay?
I mean, just not sleeping, or wanting to sleep too much, just doesn't have the stamina, doesn't have the drive to just go on, the frequent crying, just emotional swings. And then there's the really scary that there's actually postpartum psychosis, when someone would potentially seem to want to hurt themselves or the baby. They hear voices. It can be it can be extraordinarily scary, and it's extraordinarily serious, and it's something I didn't really pay attention to until like I went through it, and I like read about it, learned about it, and again, it's just like a lot of these things, it's just not talked about as much as it should be.
Yeah, 100%.
Yeah.
What, like, if you are recognizing these warning signs in a loved one, what should you do to help?
So, one thing I just realized, when you go to the pediatrician, actually the pediatrician will actually will quiz or ask the mother to fill out questionnaires about the warning signs for postpartum. So they're trying to get because they know that you're going to follow up with the pediatrician for the baby. So they're trying to identify it there and get your help. So what do? You just need to speak to your OB/GYN or to your primary care provider. You need to speak to a medical professional, and then they can determine the best course of action, from everything from therapy to support groups to even starting on medication to help just balance you out and get you through that really difficult time. But there's a lot of different treatment and option plans. If you don't want to go on medications, there's other things that you can do.
Yeah. Okay, great. Yeah. Cause I know like sometimes you, as a person that doesn't have any kids, like I don't know what to
look for.
Yeah. Like I've never been through that. So I don't know if one of my friends or family members was going through it, like, I don't know if I would necessarily recognize it.
Yeah.
So.
Or pick up on it.
Yeah. And I think it's just like having, like, looking people in the eyes and being like, are you okay? Like, how is it going? And you'll see on their micro expression, their first reaction of like, no, I'm not. I think, you just need a trusted person to to ask questions. It's really funny. And, whenever I was pregnant, everything was about me, especially before I had the first pregnancy. It was like, people open the door for you. You're like, okay, like, are you okay? Okay, okay. As soon as that baby leaves you, you're like,
chopped liver.
ain't nobody care about me anymore. Like when you're
Mhm.
walking out of the hospital, it's like, oh, the door slammed in my face. Like, oh, I haven't been treated like this for the last 9 months. And it's I don't know. I feel like the mother does sometimes kind of get lost in the shuffle of things. And
Yeah.
I think I was sort of surprised. Everything for 9 months is about you and the baby and how do you feel? What's the name? Is it a boy? Is it a girl? Like, oh, you're carrying high, low, people commenting on your body, like all this stuff. And then all of a sudden, phew, nothing.
You're done. You're
It's weird.
chopped
It's
liver.
just such a weird thing. It's super weird.
I like this. I like this episode.
I like the episode too.
I'm
I
just
was a little bit
learning.
anxious about it, to be honest with you, because I'm like, what the heck am I going to talk about?
No,
With
you're
these
doing a
lovely
great
ladies.
job.
All
Yeah,
of these
I hope
things.
so.
All of
No,
things.
this is great. So is there anything else that you can kind of think of that wasn't asked that you think would be important?
One thing is that sometimes, so just to put it out there to summarize everything, you likely are going to get extraordinarily more fertile after weight loss surgery. You are, the PCOS, the insulin resistance is going to start to improve. You're gonna have an improvement in insulin sensitivity. Some of the, maybe the hair distribution, I don't get a period, those sorts of things typically are going to start to kind of normalize. And even if you don't get a period, you might be very well ovulating.
Yeah.
I'm telling you, it's
Yeah.
very true. The metabolic improvement and just the hormonal changes and all that stuff lead to you, most of the time, almost across the board, having some more level of fertility. So sometimes that's a warning. I don't want this. Sometimes that is amazing news. And that's the whole reason, the driving force for people to have bariatric surgeries, because they want so badly to be able to carry their own child and to have a baby. Another big thing I see is that these fertility clinics will not a lot of times put patients on regimens or even allow them to do IUI or IVF until they get below a certain BMI. So sometimes I get these patients so that they can get the BMI to qualify for it. And I love it when I'm like, oh, you got pregnant without any of that, which is fabulous news. But sometimes that happens. And, sometimes it's your advanced maternal age. Maybe you, I had endometriosis was my underlying issue. Maybe you just have infertility of unknown origin. There's like a lot of things. And sometimes it's just, it's tough. And it's still, even after all of this, it's still hard. And, and it's just, listen, I can tell you with complete empathy that I do get it. And, such a hard road when that's what you really want. And it's hard to think about anything else. But I hope that you will seek out the advice of others. If you don't like the opinion of the person that you go to, you go to another fertility doctor. You don't give up, and you reach out to others that are going through similar things and share your stories and all that kind of stuff.
Yeah.
So
yeah, I remember
good luck.
there would be times that like one of my friends would say that they're pregnant and I would just lose it.
Yeah.
Because I was just like, I could not take it. Like the other people were having an easier time. I mean, now I look back and I'm like, thank God, because of what I'm going through. But I can remember that like heart-wrenching, like just despair of being like, why won't this just work? Like I'm doing everything right. I don't understand. So
oh yeah. I mean,
I get it.
Like the social media announcements, like the little cute board, the little cute thing. It is very triggering. I mean, I couldn't even look at it. It was just like, even my own sister, when my sister told me she was pregnant, the first time I was like, oh, that's awesome. The second time it was like years later and I'm still in this whole like thing. It was like, there were some moments of infinite sadness. Infinite sadness.
I can remember
and
that very clearly. I went through that exact same thing. Like I remember one of my best friends got pregnant and she announced it to us and I was like, I don't even know what to do with these feelings, so I'm just gonna get wasted. And then I cried the entire night because I didn't know, like, I wanted to be happy, like you want to be happy for your sister, but then you have like this complete, like, just sadness that kind of overtakes you. Cause it's like a jealousy, but it's not a jealousy type of feeling.
Yeah.
Like you're like, I just wish I was there. Yeah.
It's like a disappointment.
Yeah. Every single time. And you're just like, why can't it just happen for everybody else, but it won't happen for me?
Yeah. It's a crushing disappointment at times.
Yes.
So I'll tell you though, the conclusion is the joy is undoubtedly in the climb. I feel like I appreciate my kids. I'm in a much better place in my career. I wouldn't likely even be in this moment right here, right now, if it wasn't for things taking a little bit longer. Like I wouldn't have put so much up front if I was a new younger mother. I just wouldn't have done or been as obsessed with this field and really my patients. I don't know. I am so thankful, and everything I hate is like everything will work out the way it's supposed to. And I mean, it's like, all right, yeah, well, I mean, I guess, but I don't know. On this one, I do feel it. And I was super private with my struggle during it. And I guess now it's easy because you have the happy ending, which I never thought I was going to have. But God, I give it up to people who both are brave enough to do it as it's happening and letting those emotions show in real time, and people who are brave enough to show their weight loss surgery journeys without, I mean, I'm sure there is some fear or level of, oh my God, am I really telling people all this stuff? It's a big deal to put yourself out there. So kudos to all that do it to hopefully inspire others. I mean, we talk about this every time, but it is just such a running thread with bravery and all of it. I think it's incredible.
Oh yeah.
Seriously.
No, I think there are some incredibly brave individuals out there that they talk about their infertility, then they talk about, the constant struggle, and then hopefully they have their happy ending where they get their little baby. But I mean, a lot of times it doesn't happen, the way you think it's supposed to, because you have like this perception in your brain of like, okay, I'm going to get married and then I'm going to wait a year.
Fantasy.
And then I'm going to get pregnant. I'm going to have 2.5 children with a little white picket fence, like that. I mean, that's how I envisioned my life. And that was not at all where it went. And so it's kind of like, it's really hard to put that out there for everybody to see and judge. And, I know I didn't talk about it. I didn't talk about the fact that I couldn't have kids. So, and then we had decided to adopt, and then I had weight loss surgery instead.
Yes, you did.
There you go.
And now I'm here. So no, I agree with the whole, like, things, I know it's cliche, but things happen for a reason. There is a reason why I could not have kids. And there was a reason why the adoption stuff didn't work out.
Well, if you think about it though, like if Dr. Dovec didn't wait till way later, she wouldn't have helped all the bariatric people that she's helped. And then if you had the kid, you might not have had weight loss surgery. And then this whole podcast and this us talking today might have never happened.
The three of us would have never
There's
even
a
been
reasoning why we're supposed to be doing this.
Yeah. Because I think we're all advocates for weight loss surgery. You're an advocate for, having infertility issues and bariatric surgery. So like, it's a thing. Like, we need to talk about it because people are unaware of a lot of these things. I mean, just those questions today, like, people have no idea what's going on.
No.
So yes.
Awesome episode. And don't forget, guys, by having weight loss surgery, you are winning by losing. And you guys have some merch, don't you guys?
Yes.
Yeah, we do.
So there is Winning by Losing, the special Dr. Dovec crossover with OSLP.
That's right.
And you can also, on the back, we have one that says, well, of course, Dr. D's has surgeon across. Yes, as surgeon, because she is the ultimate surgeon.
That's right.
And then we also have one that says bypassed. We have a sleeved one. And then we also added a switched one for those duodenal switch patients. So you can get all of your merch at oursleevedlifepodcast.com. Yes, I still love saying.com. And we also have it on our Instagram page. We have a link in our bio. You can click on that and then you just swipe through the cards, find the website, go there, purchase all of your goodies.
Yeah. And if you're just listening to this, what's wrong with you? Go watch it on YouTube.
Yes.
Because you'll get to see all of our faces and all the ridiculousness that we're like talking to you about.
Yes.
All the hand gestures.
All the hand
All
gestures.
of them.
Yes. Yes. And that is go find it's just our Sleep Life podcast on YouTube.
Yeah.
Just
not hard.
type that in. Yeah. Really easy. And then also, if you like these videos and you like the other videos, go onto our Patreon and sign up.
Yeah, because then you can get all of our episodes.
Yes. And it is patreon.com/OSLP.
That's right.
Yes. All right.
Wow.
I know. I feel like we got it all.
We did.
We got it all. I'm impressed by you, boss babes. I mean, just loving it all. I think it's so great what you're doing for the community. I cannot thank you enough. I would just keep doing these podcasts at the end of time. If people are listening, we're going to keep on chatting it up.
Yeah.
Yes.
That's
Send
what I
us
love to
all
hear.
the questions. All the questions. Nothing is off limits.
Nothing.
So
Totally. As you learned tonight, we went on some weird tangents, but I
Yeah,
hope you
we
guys had
did.
fun, and you'll be quoting me at the Thanksgiving dinner table this year. Some of these little fun facts you've learned.
Oh, the
yes,
vault.
I love it.
can't
Yes,
wait.
the Rectal Vault. I love it. All right.
I love it
So,
too.
Dr. D, if you want to hang out for just a second, we'll say goodbye to everybody. And thank you guys for listening. I wanted to give you a good pause.
Oh, okay.
I was trying to be nice
I don't know what the pause is for.
so that you,
Nope.
whatever. She's not taking it out. Anyways,
Nope.
thank you guys for listening. Thank you, Dr. D, for being here. And we will see you next time.
Bye.